My name is Avni Shah. I'm from CDL-Toronto, and starting July 1, I'll be the new academic director and site lead. Thank you. Thank you, Jen. I also have the privilege of being the lead for our CDL Neuro stream, which supports ventures at the cutting edge of brain health, neuromonitoring, and computational neuroscience. To date, CDL Neuro Ventures have created over $900 million in equity value, with 24 ventures graduating from the program, including Exonus Therapeutics, which recently raised an oversubscribed $115 million Series A round for breakthrough treatments in epilepsy and pain. All right, so I think that deserves a round of applause. Now, today, I'm thrilled to introduce one of our standout neuro graduates, Lantern Laboratory. The venture is founded by Dr. Mira Garcia, a former assistant professor at Columbia University. Lantern is tackling a long-standing gap in anesthesia care: the lack of objective, real-time monitoring for pain perception during surgery, especially under sedation. Their proprietary algorithms decode EEG signals in real time to detect pain responses, giving anesthesiologists a powerful tool to fine-tune dosing, improve patient safety, and reduce risks like post-operative delirium and cognitive decline. The company's tech is built on data from over 2,000 surgeries at Columbia and is clinically led by Dr. Paul Garcia, Chief of Neuroanesthesiology at Columbia University Medical Center, one of the world's leading experts in perioperative brain health. This is a company with the potential to redefine anesthesia care as we know it. So please join me in welcoming Dr. Mira Garcia from Lantern Laboratory.
Thank you. Thank you so much. Yes. Hi, everybody. I'm really excited to be here today to talk to you about Lantern Laboratory. My husband is an anesthesiologist. I'm a surgeon. And over the course of our career, we became incredibly concerned about the imprecise nature of clinical decision-making in anesthesiology. We are dosing the brain with potent anesthetic medications without directly monitoring it. And that is mind-blowing to us. So we decided to innovate. We are building a brain state monitor that will take anesthesia from clinical subjective art to data-driven precision medicine. All right, our story. Early in my surgical career, I realized that there was a striking pattern. Patients that woke up alert and calm did great after surgery. But after similar surgeries, if a patient woke up in pain, agitated, confused, or with other symptoms of delirium, they had really difficult, long courses of recovery, and some never recovered at all. Simultaneously, Paul's research on the brain and as an anesthesiologist showed that when you put the patient into a medical coma, outcomes are not good. But if you can get the brain and the body into a restorative hybrid sleep pattern using EEG, outcomes and long-term brain health are preserved. There is mounting evidence that poor intraoperative brain care can lead to delirium, long-term cognitive decline, and incredible health costs. However, because we don't have a monitor that allows us to really look at the brain and tease out the different components of anesthesia, ultimately, anesthesia remains a clinical art. Paul's research has shown that over 4 out of 5 patients receive imprecise anesthesia care, and they wake up in either uncontrolled pain or they've been over-sedated. Both of these two conditions lead to inflammation, which then breaks down the blood-brain barrier, destroys brain tissue, and results in delirium and its costly sequela. However, currently available monitors are called depth of anesthesia monitors, and they only measure sedation. They do not have the technology to tease out the biosignals of pain within our EEG signals. So what we need is a brain monitor that can actually take the data that we can get from the brain and tease out pain versus sedation so doctors can make more precise drug choice and dosing. Lantern's AlphaMax has solved for that. It uses off-the-shelf electrodes for ease of integration. It collects the EEG signals from the brain and analyzes it using AI-derived proprietary algorithms. And then it presents the information on a multi-axial user interface that you see in the top right-hand corner, where the doctor can see where the patient is on sedation as well on pain, and so they can really choose the right medications and give precision care. The key differentiator here is the ability to separate pain from sedation, and that makes our monitor first of its kind. At Lantern, we're targeting a $5.4 billion market just in the US alone that's growing at over 10%. It's fueled by an aging surgical population and rising complexity in our surgeries themselves. With over 225,000 operating rooms and a high-margin SaaS offering, we do believe that even modest adoption will unlock incredible recurring revenue upsides. We have been so happy with our CDL journey. We refined our pitch, we defined our regulatory strategy, and CDL helped us build an incredible value-based return on investment strategy that's already resonating with hospitals throughout the United States, where if we can only prevent 2 cases of delirium, we've already paid for the cost of our monitor. Post-CDL, we are going to FDA clearance and then to the market for multi-center clinical trials. So this is where our ask comes in. We are raising $2.5 million, and we have about 30% of it committed, and we're looking for a lead investor for a runway to get us through FDA clearance and into the market for our early trials. We already have key opinion leaders and academic medical centers who've signed on for our clinical trials in the United States and outside the United States. So we are really excited that with your investment and continued guidance, we can take anesthesia to precision medicine, and we can define the standard of care in anesthesia. Early in my career, I saw the devastating effects of imprecise anesthesia care on my patients. And working with Paul over almost 30 years, I realized the absolute importance of making sure that we give precision medicine care. Our vision is to build an EEG-based brain monitor, and our mission is to make sure that every patient receives the right medicine at the right dose at the right time. Thank you all so much, and I look forward to talking to you.